I want to thank our partners from the National Center for Quality Assurance who have engaged with many of you in discussions over the past year and incorporated your feedback to inform the resource that we will share with you today. We have over 2,000 folks registered, and we are going to start out with a quick opening poll before we jump into the content of our webinar today. So on the next slide, you'll see a QR code for a Mentimeter poll, and we'd love for you all to share with us about who you are, who's joining the poll, or who's joining our webinar today. You can either go to menti.com and use that code, or you can click on the QR code with your phone or your computer. We'll just take a minute for that and get started in just a moment. Thank you all so much for participating in our poll. We are pleased. I'm sorry, we will, I think I already thanked our National Center for Quality Assurance partners. They'll be sharing more at the end about the over 2,000 early childhood leaders who joined us today from over 50 states, from Head Starts, and from tribal nations across the country. Many of you, I know, are already working on or thinking about developing early care and education workforce salary scales for your program or your system context. So it's just great to see you all here. Thank you again for participating in the poll. I now have the privilege and the honor to introduce to you our incredible Deputy Secretary for the Department of Health and Human Services, Andrea Palm. Andrea, thank you so much for being here with us today.
Great. Thank you, Kim. It's good to be with all of you. I, in advance, want to also thank Katie Ham for her remarks and her leadership in this space. She's such an important part of our HHS team here. I really also want to, as I welcome you, thank all of the leaders from our state, territory, tribal, community level agencies, early childhood agencies, and all the programs who are participating with us today, and those of you who are currently working as early educators. Your work is absolutely essential to our economy and to ensuring that our next generation grows up healthy and can learn during these really critical years. April is Care Worker Recognition Month, which I am sure you are all well aware of. And here in the Biden-Harris administration, we're continuing to push to make advancements in the investments that we need to make in high quality, affordable childcare, preschool, and in long-term care. There's a whole care economy here that we in this administration are focused on bolstering. Every American really does deserve access to the care and support that's essential to their well-being, and the caregivers and the care workers in this space make it possible for folks to live as independently and as with as high a quality of life as is possible. And we need to make sure that they are adequately supported in that work. And we here at HHS, all across our family of agencies, are committed and working hard towards achieving that goal. So this month, as we lift up the progress that we have been making in a variety of spaces here at HHS and across multiple federal agencies in the U.S. government, to make care more affordable for families, to support our family caregivers and the care workforce, to boost compensation and job quality for this sector of the economy, and really to think about how we expand options to care. And so we're in the midst of Care Week here at USG, and we're closing it out tomorrow. But I really couldn't be happier. It seems very fitting to spend some time with all of you as we mark this important week in this important month, because you, as part of the care economy in the early care and education space, are a driving force behind all the other workforces in this space and all of our health and well-being writ large. We know that when families have access to childcare and the early care that they need, they're more likely to enter the labor force, to find and keep a job, to earn more that they need to sustain and support their families. It's a critical building block for the rest of what we do. So having said that, we all know that most families struggle to access affordable, high quality early care and education that they need. The cost of care is up 26% over the last decade and more than 200% over the last 30 years. This is a big hill for us to climb, but one, again, that we here at HHS are committed to tackling. And at the same time, our care workers, who are disproportionately women of color, struggle to make ends meet, even as they care for others. So the president has called on all of us, on Congress, on all of us in the agencies to make a historic investment in early care and education, in that infrastructure that would really make access more affordable, quality care and high quality preschool available where families live and work in communities across the country, and increase wages for early care and the education workforce to, again, really strengthen our economy. We understand how foundational these investments are. And foundational and strategic. They're important investments in our economy in the future. And as I noted, we will continue to put our shoulder against this really important work. In the meantime, we're not waiting to take action here at HHS. And we are really proud of the work that the team at ACF, I noted Katie's tremendous leadership and the work of that whole team at ACF to do what we can within the things that are within our control to improve compensation for childcare and Head Start workers. In February, we finalized a rule that will reduce the cost of childcare for more than 100,000 low-income working families and make that and make sure that more than 140,000 childcare providers are paid more fairly and on time. We also recently proposed a rule that would boost Head Start teacher wages by $10,000 on average. Again, important investments for us to be making. These proposed changes, if finalized, would stabilize the Head Start workforce and improve the quality of the comprehensive services that the Head Start families count on. It would significantly increase compensation, as I noted, for many Head Start staff, integrate mental health services into Head Start programming more broadly, and otherwise really enhance services to help Head Start programs effectively and equitably, very importantly, equitably, meet the evolving needs of all of the communities that they serve. So as I noted, it's a proposed rule, but we are working hard to finalize because we understand how important this rulemaking is, and that these are significant steps forward for the early childhood system and for, again, supporting the really foundational work that all of you do in this space. So again, I'm glad to see our state and local leaders on the call today. And I'm glad that you all will have time in this setting to share creative ways that you all have pushed forward in this space. I know that many of you bring considerable vision and leadership to the work that needs to be done, and being able to share those ideas, those best practices, that work with each other not only is inspiring, but it will help us all do the work together better. So I really do appreciate this opportunity and the ways in which you all are leaning in to support and help each other and do the work together. And we here at HHS and in the federal family are anxious to continuing our partnership with all of you and to continue to push for the bold investments and the work that we need to do together. And so again, much appreciation for the invitation to spend some time with you today. My appreciation for all the work that you are doing. And I will turn it over to Katie Ham, who is our Deputy Assistant Secretary for Early Childhood Development at the Administration for Children and Families. Over to you, Katie.
Thank you so much, Deputy Secretary Palm, for your comments and all of your support for our work to really strengthen the early care and education workforce. I also want to just extend a huge thanks to those of you who joined us. I know that there are a lot of different things and pressing priorities for your time, and I appreciate you spending this hour with us. Many years ago, I was a parent volunteer at my son's childcare center and had the privilege of helping shape the salary scale on a much smaller scale than some of the leaders you'll hear from later today. It can be complicated. It can be a daunting task, which is why we've really put a playbook in place to support folks who are trying to do this. But I also learned through that process just how important it is. There was nothing that was more influential on my son's experience in childcare than having access to high quality, highly qualified, effective teachers who knew how to work with infants and toddlers and young children, and being able to pay them at a level that reflected that skill and allowed them to stay in their roles and support their own families was a critical component of that childcare program. So I, from a personal perspective and professional perspective, am really excited to be here with you today and talk more about this important resource. At ACF, we are really committed to building an early childhood system that attracts, prepares, and supports and retains a qualified and importantly diverse workforce across settings and programs that serves children and families effectively. And we know that includes compensation and benefits, as well as pathways for career advancement and improving working conditions that really reflect the value of the early childhood workforce. As the Deputy Secretary said, we are really focused on caregivers and early educators this month and this week to really hold up all the things we as policymakers can be doing to better support. The early childhood workforce plays a critical role in our communities. It's played a critical role in my family. We know it's intense and skilled work, yet still these workers are among the lowest paid in the country. As the Deputy Secretary said, it's also a workforce that is disproportionately women of color who perform an incredibly important service for our country and for our economy. And we know that low compensation for the workforce is not new. We know that that is rooted in our country's history of slavery when we had people who were providing childcare for free and who were unpaid. And we still see disparities today in wages for Black early educators as compared to their white counterparts. And we see disparities by setting, by funding source, and by age group. We know that early educators who work with younger children who are working with infants and toddlers are paid less, and they're also more likely to be women of color. The good news is we have an opportunity to change that, to really think about that and create equitable salary scales that ensure that regardless of who you are or what ages you serve or the setting you're in, whether that's home-based, childcare centers, schools, or Head Start, you're paid competitively and have pay parity with those who have comparable experience, qualifications, and roles and responsibilities. So before we move into our panel, I want to talk a little bit more about what we are doing at the federal level to partner with our grantees in states and communities to address low compensation staffing shortages in the workforce. Importantly, the president's budget proposes a historic investment in the early care and education system. It's a $600 billion proposal over 10 years. It would decrease the cost of childcare for 16 million children. It would also provide universal preschool in communities across the country, and it would guarantee higher wages for staff. We know this is the kind of investment that we need, and we have called time and again on Congress to support that investment. In the meantime, as the Deputy Secretary said, we are moving forward. We implemented the American Rescue Plan and other COVID relief funds in states and with Head Start programs to really support the early childhood workforce and support some of those additional benefits and compensation to recognize the work that early childhood educators did during the pandemic and in the wake of the pandemic. In the last several years, many states have invested preschool development grant funds and dedicated new state funds to sustaining some of those COVID era investments in the workforce through grants to childcare providers and other strategies that support recruitment and retention. And we're also pursuing regulatory options. We finalized a rule for childcare that improves payment practices, that helps to stabilize operations for childcare providers who are participating in our subsidy system. We've also let states know that they need to increase their payment rates to providers if they're deemed too low. And last year, we also released a proposed rule that is not yet finalized for Head Start that would change the performance standards to require pay parity between preschool teachers in public schools and Head Start teachers, as well as increase the floor for all staff in Head Start. We've also invested in technical assistance and support for those of you who are working in programs and in communities and states across the country. One of the things we did is create a national early care and education workforce center that has recently revamped their website, and they are providing more information on Grow Your Own specifically as a strategy and highlighting some of those promising strategies. If you want to go to the next slide, to the main event, today we are rolling out a new resource, the Salary Scale Playbook, that was developed by our Office of Child Care's National Center for Early Childhood Quality Assurance and in partnership with the Office of Early Childhood Development and the Office of Head Start to really look at early childhood programs and systems leaders through key actions and steps that will support developing a salary scale. The resource attempts to address how we think about and how we create an equitable pay scale that will improve wages for the early care and education workforce across settings and ages served. If we want to go to the next slide, the playbook highlights 5 essential actions and key considerations for developing a salary scale, which are shown on the slide, and offer considerations, tips, tools, and resources for those action steps. So they are, you'll see them on the screen, articulate the need for and value of a salary scale, convene key partners to guide salary scale development, identify and use data, develop a salary scale structure, create an implementation plan. And the team has created an easy to read summary with one-pagers for each of these essential actions that you can quickly orient yourselves in your busy days. And then there's a more in-depth discussion and links to key resources. Each essential action will include the what, why, and how, along with tools and resources to support that essential action. Importantly, the playbook also includes examples of various approaches that states, communities, and Head Start programs have taken in their scale development process. We're excited to bring these examples to life for you today. We have some great partners from states, communities, and Head Start to highlight examples. I really hope that for those of you who are just getting started or are thinking about updating a salary scale, this tool will be a guidepost that will fast track your progress and allow you to pull lessons from those who have gone before you. And to all of you who are working to improve compensation, please know that we are cheering you on. We are here to support you along the way. I really want to leave you with just my gratitude and gratefulness for the important work that you are doing. There'll be additional opportunities to engage with our technical assistance partners to use this tool. And with that, I will pass it over to Kim Burgess-Sims, Senior Policy Advisor in our Office of Early Childhood Development, who will introduce the panelists and moderate what I expect will be a very lively discussion today. Kim?
Thanks so much, Katie. If we go to the next slide, I'm so excited to turn to this wonderful panel of experts from 2 states, from Colorado and Minnesota, and from San Francisco, and from a Head Start program in Missouri. We are so thrilled to, like Katie and our Deputy Secretary shared, just to hear your state and local perspectives for those of you who've been grappling with this and the challenges, the technical challenges, the engagement challenges, everything that kind of goes into developing a salary scale that is equitable and works. If you go to the next slide, please, we'd love to introduce to you and maybe we can pull them up on screen as I do. Susan Zhang, the Workforce Initiatives Manager in San Francisco's Department of Early Childhood. Welcome, Susan. Angela Benzekri, Workforce Strategy and System Leadership Unit Manager at the Colorado Department of Early Childhood. Kimberly Shin Brown, our Head Start Program Director from the Ozarks Area Community Action Corporation. Welcome, Kimberly and Angela. And Carrie Gershon, Professional Development Policy Specialist at the Minnesota Department of Human Services. Thank you to you wonderful group of leaders. We're so excited to hear from each of you, your different perspectives today. And I think we're going to start off with a question for you, Susan. Susan, in San Francisco, you all developed a salary scale to inform your effort to bring early educators up to $28 per hour. Tell us about what led you to the development of this salary scale and how you've used it in San Francisco.
Thanks so much for this opportunity to share our workforce initiatives. So we brought everyone to $28 based on an MIT living wage scale. And I think it was important for the city and county of San Francisco to consider the high cost of living in a city like San Francisco. And so that was important for us to consider the cost of housing, the cost of food, and all of that's combined. So that is the living wage scale that we used in order to determine the baseline salaries for our what we call our early educator salary support grant initiative. And what's also important to know is that we plan to rebench every 3 years. So we know that it goes up and down, and so that's important for us to consider rebenching every couple of years. These are the opening slides. Is that okay? Great, thank you. If we can go back to the first slide, just to give you some history about the compensation initiative for San Francisco. I think it's important to note that as we began this work, that it did not happen overnight, and it would not have been realized without the significant source of funding that we have today. Before what we know today as Prop C, Baby Prop C, which currently funds our compensation initiatives, San Francisco had several local ballot measures over the past 20 years that dedicated funding for children and families, including early education. These local measures really set the groundwork to building political will and proof of investment that has led us to directing significant investment solely and directly for early education. When Baby Prop C was passed in San Francisco in 2018, the ballot language specifically called out for the investment of addressing compensation for early educators, in addition to the provision of affordable early care and education programs for eligible families. We go to the next slide, which leads us to the formation of San Francisco Department of Early Childhood's Workforce Compensation Initiative, whose goal is to provide improved outcomes for San Francisco's children and families by providing additional compensation to support a well-educated and well-compensated stable workforce. Next slide. Our initiative has a two-prong approach. Our first prong is the Early Educator Salary Support Grant, also known as EESSG. And the second is our Compensation and Retention Educator Stipends, also known as CARES 3.0. If you're wondering if there's a 1.0 and a 2.0, there was. CARES as an initiative started in 1999 with local and state investments, and to date, CARES 3.0 is San Francisco's largest investment since its inception. With EESSG, DEC provides a direct grant to child development programs and agencies. Agency administrators work in collaboration with DEC to administer grant funding that increases eligible educator salaries directly through agency payroll. And that is a critical difference between CARES and EESSG. It's the payroll portion. CARES 3.0, with CARES 3.0, eligible educators apply to and receive stipends directly from DEC twice annually. Next slide. Oh, actually, previous slide, sorry. So why do we have two funding strategies? I think it's important for us to share this. As we were beginning to designing the EESSG initiative, we engaged with educator communities, including family childcare owners and operators. And what we heard very clearly from providers was that they preferred the CARES model, which was a direct stipend. And most of the feedback that we received was speaking to the fact that many of our family child care providers did not have the typical back office support that you would see in center-based programs such as HR and accounting. What is common, however, amongst the two initiatives or two programs is that both ensure that the highest level of compensation support is going to programs serving the highest need communities in which we have traditionally seen the highest turnover rates of staff. And the funding structure and compensation is based on the percentage of subsidy eligible children being served. So as we take a next slide, as we take a closer look at our data, this is our year one data for EESSG. In its first year, EESSG saw educators increase their earnings by 30 to 47% more, and no teacher earned less than $28 per hour. So as I alluded to earlier, our baseline hourly rate is $28 per hour. What we see on average is that the average salary range is $29.50 to $37 per hour. Next slide speaks to our CARES program. CARES 3.0 also saw a substantial increase in educator wages. Over 1,600 of our educators saw an average of $12,336 in 2023. Next slide. I think what's critically important is to note that while it's important to see higher wages and it's important to make note of that, I think what our workforce compensation's true impact is best seen and understood through our educators' transformative stories. And what you see before you on this slide is the results of our biannual survey of educators who participate in both EESSG and CARES. This increase has improved the financial stability of early educators who are able to better support families and also to invest in their professional development. What we've also heard and have read is that educators are feeling satisfied with their current positions. They feel improved working conditions and overall positive change in their work environments. Educators now have a better work-life balance, which allows them to be more effective in their roles as educators. In our final slide, as San Francisco's compensation initiative continues to develop, as we continue to develop, we center our work on the importance of stable and well-compensated and qualified early educator workforce. We believe that early educators are the backbone of our community and they shape the future of our children and our city. Thank you.
Thank you so much, Susan. Those results you shared, both the 30% compensation increases and those experiences, those stories of the working conditions and experiences of the educators are so helpful to hear and motivating our work. I want to turn now to Angela. Angela, in Colorado, you all developed a scale around the time of your universal preschool expansion. Can you share with us what led to your work digging into salary scales, your process, and how you've developed a statewide salary scale for your early educators?
Absolutely. So we can go to the next slide. So in Colorado, we had several motivating factors to create our salary scales, some that date back actually to about 2016 and 2017, which is when we wrote our Early Childhood Workforce 2020 plan with a strategic roadmap and a vision of what we hope to accomplish in Colorado by 2020. That was unbeknownst to us before the events of 2020 kind of rolled out with COVID hitting. But in that plan, we identified the opportunity to create compensation scales and identify the funding gaps that we had in our state to achieve livable wages. From there, we also had what we call our Senate Bill 19063 action plan, which our state legislature actually asked us to do a study on the loss of family childcare home providers over the previous decade in the state. And unfortunately, not surprisingly, that compensation and resources and funding for resources for quality childcare programs were identified as major barriers to staying in the field as a family childcare home provider. And then last but not least, in fall of 2020, we passed Proposition EE, which is a ballot measure to partially subsidize preschool for every child in the year before they attend kindergarten. And so this was a major new funding stream for us and a really exciting factor, which made us go back and revisit these previous plans to think through how we could fund our universal preschool program to support some of these opportunities in mixed delivery settings. So thinking about wages and benefits and cost of quality as factors within our rate setting for our new universal preschool program. As we were doing all of that planning, actually in July of 2022, we launched our Colorado Department of Early Childhood, which combined the operations that were previously housed within our Department of Human Services, and then our preschool programs that were housed within our Department of Education into one consolidated department so that we could really dive deeply into these components, as well as maintain our childcare licensing regulations, our quality initiatives, and build a more robust workforce division, which also launched at that same time. So we have teams of people who are diving into each of these factors. And so we have over $300 million coming in for our preschool program to support these initiatives. And we knew that that was kind of a pinnacle moment for rate setting, that we needed to go back and create these compensation scales so that we could consider things. And we'll go to the next slide, actually, so I can talk a little bit about some of our decision making. So we could consider things like parity with K-12. We could look at cost of living by region and geographic boundaries. What were the major makeup of families in Colorado? We use the MIT Livable Wage Calculator, which I think you'll hear from most of us today is a really great tool to think about cost of living in your state. We were really, again, considering who in our state would be eligible. How could we narrow down some of our decisions and not kind of swallow this whole thing at once? So we really honed in on our mixed delivery settings as of right now for those who would be eligible for our subsidy and universal preschool program. We hope to expand the list of folks that will be reflected in our salary scales in the future. We were also considering, what scales or what qualifications and experience do we want to nest this to? So we chose our early childhood professional credential, which is our state our Department of Early Childhood backed credential, which assigns points for education attainment, our professional development, years of experience, and demonstrated competency, rather than this just being nested in higher education attainment, which we know through our workforce data is maybe on the lower end, and that's a goal that we can work towards. And then additional specializations, we actually did not include in our salary scales at this time, but we identified opportunities for additional stipends or potential for tax credits in the future for specialized components, such as serving in infant toddler classrooms, being a multilingual professional, and other things like the number of children that are receiving subsidy in your program. So those were some of the factors that we made adjacent recommendations to through our salary scale, and will be linked in the slides when they come out. Aside from that, I would love to go to the next slide and just share with you a little bit more about the regional and economic indicators. So in Colorado, we unfortunately do not have any regions that we would call low-cost regions in our state. We have a very unique economic footprint in our geography in that we have kind of high cost of living urban centers. We have high cost mountain resort communities, which drive a lot of tourism, both through ski resorts and through summer recreation. And that drives up cost of living in those areas. And then we also have rural and frontier communities. So we have 3 zones that we've identified. We were really careful in the naming conventions that we chose so that it was inviting in conversation for our advocates in the state. And I say advocates and partners specifically because these are still recommended in nature. If we go to the next slide, we can give you a sneak peek of the salary scales that we've created. So this is the highest cost of living salary scale as an example in the slide here. And these are a representation of pay floors for us in Colorado. So we were thinking about this from a perspective of where would each of these rungs start? And we didn't build out kind of that horizontal recommendation on what would reduce compression in these spaces. So folks have, again, those specialized criteria or special age groups served, multilingual, folks could build out additional steps within each of these categories eventually if we're able to move to implementation. We were intentional in starting the very first step on the scale at a livable wage for that community, and then growing the steps from there. And we also had a goal of pay parity for each of these kind of categories of position. And so we intentionally set our early childhood lead teacher qualification to lead towards a K-12 pay parity teacher space. And so we put that at our level 6 rung because that assumes that there's higher education attainment to about a BA level or potentially a master's level as well. So that's reflective of what a K-12 teacher would also have in our state. And then I want to note too that our family child care providers were included at the same level as a small center director in our state, because they serve as both an administrator and of course their lead educator for their program. And so we put them in the scales that would put them at pay parity with an assistant principal within a program or within a K-12 setting, excuse me. And then lastly, our large center directors would have pay parity towards a K-12 principal level, knowing that many of our programs have equal kind of enrollment as some of our elementary schools in our state. We also noted here that these do not represent an unfunded mandate. I've seen a lot of questions in the chat about, where's the funding coming from for a lot of this. We're still figuring out a lot of those answers in Colorado and have some innovation grants to come that will help us with some of the planning for this. And we also have some working groups that we're going to be doing with local communities. So we're really excited about the next steps to pursue a lot of these recommendations. And I'm looking for some questions a little bit later.
Thank you, Angela. It's great to hear. Thank you so much for sharing the ways that you address some of these key decision points about how to account for experience and geographic variation. I know that these are some of the things people are grappling with as they embark on this. So it's great to get a little taste of that from you, and looking forward to more. And I want to turn to Kimberly Shin Brown. Kimberly, you guys really dug into this work to update and develop your salary scale in a Head Start context in your program in the Ozark region of Missouri. Tell us about what led you to really deeply engaging in this work and what it has meant for your program and staffing.
Thank you for the opportunity to share, and I'm excited to represent Head Start programs. Like many people in the early child care and education field, I did not come to this work with a background in business. So the thought of creating salary scales or structuring salary scales, making substantive changes was unnerving, but we had a simple salary scale that we had been using for many years, but we found ourselves struggling to attract and retain qualified talent around mid-2000s. And so we knew that we knew enough to be dangerous, and we reached out to a consultant who could coach us, not just provide us with a new wage scale, but to teach us how to do wage comparability, how to look at benchmarking, how to look at setting steps between different degree requirements or skill capacities, so that we could use that coaching experience to continue to grow our own without having to go back to a consultant. And that was incredibly helpful to us. It was really important to us that we made sure that our scale was sustainable. And I'm seeing lots and lots of comments in the chat box and in the question box about how do we sustain this? How do we do this? We know that funding streams, no matter what the stream is, can be unpredictable and somewhat unreliable at times. So we use cost modeling to make sure that any changes that we are making to our salary scale are indeed sustainable over time. Next slide, thank you. When we built our salary scale, we gathered a lot of data. We know that salary scales are a direct reflection of an organization's priorities and values. And so we gathered lots of data. We intended to differentiate between the roles in our programs, and I've seen that in the questions as well. Everything from a bus driver, a kitchen staff person, to a lead teacher, a center director, and the program director. So every role within our organization is benchmarked, and we have a salary scale that is consistent for each of those positions. We also knew that we needed to attract talent to our full year programs. We have 8 different models that we run across 10 counties. And we needed to drive qualified staff to those full year programs so that they were sustainable and of high quality. So we separated out in our salary scale a differentiation between a teacher assistant in a part year classroom versus a teacher assistant in a full year classroom. And we assigned compensation differently because those roles look different. We also identified a qualification progression, starting with a base rate, so a high school diploma. Or if a high school diploma is not required for the position, then whatever the base is, we started there and then set graduated steps based on increasing levels of skill and credentialing or degrees. We tie that compensation to steps so that it increases staff's willingness to seek credentialing or to seek additional college hours, all of which we believe supports ongoing quality and retaining an effective workforce. So we also include in our salary scale the step. So how did we get from the base rate to an AA degree in early childhood? So you can see on our salary scale that it's 2.5% for each step up to that point, and then 7.5% increase between an AA early childhood education credential and a bachelor's level early childhood credential. This provides transparency to our staff so that they know exactly what they can anticipate as they move forward. And we find that that builds trust, and it also supports pay equity. In our salary scale, we tied it together in an Excel spreadsheet because, as I mentioned, sustainability is so incredibly important, and an error can be extremely costly. So in my Excel spreadsheet, I can easily make one change in one place, and because all of the scales are tied together, it will move that increase all the way through the scale, and I can then use that for cost modeling. I know exactly what it's going to cost if I make this small change to this one spot. I think wage compression is a huge thing that we need to keep in the front of our minds. And I've also seen that in the questions on the board. Wage compression impacts retention and it impacts staff morale. And because we wanted to avoid that wage compression, we intentionally differentiated between a salary scale for brand new employees who have never worked for us and staff who have at least one full program year of experience with us. So at our fiscal year is a September 1 fiscal year. So every September 1, we take the salaries for everyone who was hired at least 12 months prior and move them from the starting employee scale to what we call an existing salary scale. So everybody gets that bump in addition to whatever COLA we have that we're offering or adjustment that we're offering for that additional year. And this does help combat that the wage compression issue that can be incredibly challenging for programs. I think when we go back to being flexible, a salary scale that's effective also has to be flexible. So we have mechanisms in place that we can do merit increases for staff who are doing amazing work and needed to be recognized accordingly. We also look at equity, which we did in the very, very beginning, and we do that review annually as I move staff from a new scale to an existing scale. So we want to make sure that staff are being paid comparatively for qualifications, for length of service, for roles, and for other skills or credentials or criteria that we've established. We also felt it was incredibly important for us to have a preschool pay scale that is the same as our infant toddler pay scale. We did not want to drive staff one direction or the other. We didn't want to pay differently for the work of infants and toddlers, even though sometimes in society we are not necessarily valuing those efforts the same way. We wanted to make sure that we are demonstrating that our value is all children across the birth to 5 spectrum. So we intentionally made sure that that our scales are equitable across our infant toddler scale and our preschool scale. And then transparency. I talked about that a little bit. I can't over articulate how important it is for staff to know that this is an equitable scale. It is a transparent scale. They can see what they are currently making and how it relates to other positions, other qualifications. And I wish I could tell you that it has dramatically changed our retention, and it hasn't. But I think it has kept us from falling any further behind than what we might have otherwise been coming out of the COVID pandemic and all the other challenges that programs are facing. I will put a plug in there in terms of how do we fund things beyond just our grant funding. We leverage childcare assistance, state childcare assistance for the hours before and after Head Start in our full year programming. We also leverage Medicaid dollars to offset the costs of some of our other staff, like our nurses and our counselors. So I think it's really important as you're thinking about a salary scale to be as innovative as you possibly can in what salaries, what funding streams can we pull down to augment and expand what we're able to offer in terms of compensation.
Thanks, Kimberly. So helpful to hear about the really in-depth way you have worked on developing your scale and how you've innovated also in how you're braiding funding streams together. Thank you so much for sharing that. Carrie, I want to turn to you now in Minnesota. We know that you guys are actively working on developing and piloting a salary scale in Minnesota statewide, and you have a legislatively mandated task force. But you started a lot of this work in the context of investing American Rescue Plan funds. Tell us about your experience and what you are learning as you develop your statewide scale.
Absolutely. Thank you so much. And first, let me just say it's such an honor and a privilege to be here today, especially with all of the other esteemed panelists. So when American Rescue Plan funding ended, state lawmakers created the Great Start Compensation Support Payment Program. And 100% of that funding is used to increase staff compensation in eligible programs. It is a permanent program. It is now part of the base budget, and it increases compensation by a minimum of $375 per full-time staff person in eligible programs. It's non-competitive. Programs resubmit monthly to note their full-time staff and that they served children during the previous month. So that amount can vary, but would only increase from $375 per month if there are fewer eligible programs or full-time staff in any given month, but it is stable across every staff person. However, in addition to that, the state legislature passed a bill in 2021 that stated it is the goal of the state of Minnesota for all families to have access to affordable, high quality early care and education that enriches, nurtures, and supports children and their families. And with that, they established the Great Start for All Minnesota Children Task Force. So that task force recognized that the childcare market is broken. Parents cannot afford to pay what it costs to have staff that earn livable wages. The task force made many suggestions in their final report. It's a long final report. I personally have become very familiar with it and reference it daily. It contains a lot of really interesting tidbits that I find helpful as I go through and think about how we can conceive of a market differently. But the legislative session in 2023 had a piece that was particular to the Department of Human Services, where I work, that directed us to work with the Departments of Education, Employment and Economic Development, and the Children's Cabinet, along with relevant interest holders, to implement some of the recommendations of the Great Start Task Force. This included a wage scale. And in order to do this, we must create a process where we recognize comparable competencies for people who do not hold early childhood degrees and credentials. We must also provide recommended wages that provide parity with elementary school educators that have similar credentials and experience, and make benefit recommendations. Next slide, please. The wage scale would apply to family childcare, licensed childcare centers, certified centers, school readiness programs, early childhood family education, voluntary pre-kindergarten, school readiness, early childhood special ed, and Head Start programs. So we have a broad mandate ahead of us. We're currently working on that. And I believe that you're going to hear a little bit more about that along with a pay equity pilot that we have ongoing in a few minutes.
Thanks so much, Carrie. So now I think we get to go to the discussion part with all of you and follow up on some of these themes you all have already touched on. So one thing I wanted to talk about that I don't think came up a lot so far is the Salary Scale Playbook talks about the importance of engaging early childhood workforce partners. So people who are engaged and invested in the salary scale, and especially people with lived experience, those who are going to be most impacted by the scale, the workers themselves. So how would you recommend that others developing salary or pay scales engage partners? What are your experiences or lessons learned as you have moved through your processes, and which partners did you engage?
I'm happy to jump in and lead off on this one. In Colorado, we found that it was really important to have, first of all, I'll say a third-party facilitator who came in and helped us moderate these task force meetings, so that us at the Department of Early Childhood, as well as our other state partners that were represented, that included our Department of Higher Education, to make sure that higher education attainment was, of course, included on that. Our partners at Department of Education for teacher licensure and things of that nature. So we had several state agencies there. We wanted to be able to listen, to your point, to all of these early childhood stakeholders to ensure that we took into account a lot of their concerns and provide a litmus test to some of the decisions that need to be made on where to start the scale, what type of parity were we looking for, via what positions, who should be included in this. So that facilitator was important to us. In terms of participants, we had folks from the business community, state agency partners, like I mentioned, institutes of higher education. We had early childhood associations that represented both childcare centers and family childcare providers. We had Head Start and Early Head Start, school districts. We also had a K-12 union involved, because we also know that we're on the lower level of K-12 education investment across the country. And we know that that would create compression in our kind of quest for parity. So we want to make sure that we're elevating both the early childhood and the K-12 components of concerns with education and pay parity and compensation overall. We had our universal preschool program implementing local partners, as well as our early childhood programs, early childhood councils, that serve as our CCR&Rs in Colorado. We had coalition building organizations and advocacy organizations, philanthropic partners, and shared services partners. So very robust group of folks that were included in our task force. We brought them together in fall of 2022. We brought them together again in fall of 2023 to talk about benefits after we had created our compensation scales. And we have future plans to bring them together for working groups associated with our innovation grant for plans for implementation. So this group of folks is going to be key to making sure that we have that investment and buy-in from the community as we work towards implementation.
That's an impressive list of partners, and it sounds like a lot of effort, but it also sounds like you've been able to really leverage that group for additional work beyond your initial, even what you initially engaged them around. So that's really exciting. Others, who have you engaged, lessons learned on engaging partners?
In Minnesota, the Great Start Task Force had written into legislation certain members who needed to be part of the task force. And we're fortunate that we were able to build upon the engagement that they had done with those individuals and other interested parties. But the state of Minnesota has also been working to be an anti-racist state, and the Department of Human Services to be an anti-racist organization. And each of us as employees work to engage individuals, organizations, and to take time to cultivate relationships across organizations and to share opportunities with one another. So from a personal perspective, I take the opportunity to share this with other people who then connect me with other interested parties. And with that, we've had the opportunity to connect with family childcare associations, licensors, and in addition to some of the people that Angela named, I do actually now am thinking that we need to get involved with some school districts and their unions. Thank you for that idea. I would say that the folks that I didn't hear named within those organizations, we have some pretty vocal advocates within the legislative space that we took the opportunity to partner with early and often, and to ask them, what are the things that are important to you, and then to center the most marginalized people, the folks who would be impacted by this and who traditionally have not had their voices heard in these spaces.
Thanks. Those are great reflections. And, one of the things beyond who you engage in the development of your scale, an important decision that's in the playbook is really about like what roles and what sectors of the workforce you're including in your scale. And some of you talked about this, thinking about family child care and infant toddler care and other parts of the diverse workforce that we have in our local community, state, or Head Start or local program context. So would love to hear more about how you all thought about these different parts of the sectors, if you want to elaborate on that.
I can share a little bit about San Francisco's engagement. So as I shared, the Baby Prop C was passed by voters in 2018. And when those funds were released and when it was prime time for us to be able to prepare and develop our pay scale initiative, our workforce initiative, it was really at the height of the pandemic. And so coming together, bringing our communities together, was something that we did, certainly, but it was also a rushed effort because we know that compensation, particularly during the pandemic, was felt even more strongly, I think, in our communities. And so it was critically important that we rolled out our initiative sooner than later. And so while we did bring together family childcare providers and what we call our local planning council, which is a multi-stakeholder group of folks who are required to come together through the state. And while we engage with them locally, I think the biggest lesson for us is that we had to quickly pull together internally to develop these efforts or this design of the program. And so we included what we call our Title V network. These are state-funded subsidy program administrators, because we knew off the bat that was a priority organization or priority group for us to bring together. So I think the biggest lesson learned is to take the time to plan and engage. We didn't have that luxury, I think, in San Francisco because of how quickly we needed to roll out our initiative, and also the urgency around being able to provide those wages quickly at the height of the pandemic.
Thank you. I'm realizing that we are really close on time, and I have so much more I want to ask you, and I know so many others do. I don't know, Michelle, do we have time for one question from the audience? We could kind of close out on that.
Sure. I just asked everyone if they would be willing to stay on for a few extra minutes as well. So there is just so much information to share. We have a lot of really great questions that have come in. There was one specifically, and this might have been for Carrie. What are the funding sources for these higher compensation wages and stipends? And Carrie had some thoughts around that one.
I did. I think several of the questions that have come in via the Q&A or the chat have centered around how does how are states and different initiatives paying for these wages and salary scales. In Minnesota, we began with using federal funding through the American Rescue Plan, and now are using state funding for the Great Start Compensation Support Payment Program. At the same time, we've leveraged preschool development grant funding for a pay equity pilot that's ongoing in 4 communities. And although the wage and salary scale that we're developing is proposed and is due in a report to the legislature next January, if it were to be funded, that would be with state funding. I understand that there are different climates in different states and different opportunities for funding. I think that finding like-minded people, it kind of makes it sound as though one day we woke up and the state legislature decided to put something in legislation for this. And I certainly do not mean to suggest that. If I look back in the events that happened in Minnesota over the last 10 to 15 years, I can easily pluck different initiatives and people who were instrumental in this, including Power to the Profession through NACI and some workforce initiatives that were ongoing over the last 10 to 15 years to build momentum from Power to the Profession and Minnesota's early childhood workforce advocacy that was consistent and a growing voice in the legislature for our early care and education folks, and who also saw the critical importance of going to our business community as equal advocates to help us within the legislature to see the critical importance of including all of those voices in a consistent message so that we could be heard and continue to have that clear, consistent voice saying exactly what we needed to move this forward.
I would echo what Carrie's saying in terms of we have engaged our local community, our local Chamber of Commerce. We have a workforce development panel that gets together. We meet regularly to talk about this issue with chamber members so that it's part of their platform as they go to the General Assembly in Missouri. And it's really difficult to get tax increases passed in Missouri. But I think that definitely has helped businesses see how they have a stake in this puzzle and how equity and funding for salaries and compensation for early childhood ultimately is a positive impact for businesses who need women, particularly, to be engaged in the workforce and meet care in order to do so.
Well, I think we have some long-term work to do, some short-term work to do, but the great thing is that we have some resources available for you now in this playbook, and just want to thank all of our panelists so much. Each of them, their work is highlighted in the playbook, so you can go there and read more about their work, but thank you so much for sharing it today and bringing it to life for our audience of over 1,000 people who were here today. And Michelle, I think you have a resource slide or two to show at the end to close out.
Great. Thank you, Kim. And thank you again to all of our panelists. Thank you for sharing your expertise and your experiences. My goodness, there's a lot to share. So what we have on the screen today is how you reach out to request technical assistance. And you have the logo and the contact information for the National Center on Early Childhood Quality Assurance. We have the information for the National Center on Program Management and Fiscal Operations and the Office of Head Start there. We have included the contact information for the National Early Care and Education Workforce Center. And on the next slide, we have the contact information for the Tribal Child Care Capacity Building Center. That information is there on the right. We want you to know that the system of support is here for you. And we are also very happy to share that the salary scale playbook that we've talked about today is live. And we are going to share the link. Looks like we just shared that link in chat. So we encourage you to go to the CCTAN website, go directly there. The playbook is there, resources are there. And we also encourage you to reach out to your National TA Center. Support is now available to you around the playbook, whether it be to present to your staff, to provide individualized technical assistance, all of it is now available to you. And on the next slide, we just want to once again thank you for your participation today. Thank you for your commitment, for your efforts to advance, elevate, and sustain our system, our community of early care education. And with that, we thank you for your participation. We have just added a closing poll in the chat. If you would just stay on for one more minute and answer that, some of the questions there will help us as TA centers better serve you. And again, thank you so much for joining us and have a great day.